Wow, the shawarmas here in the UAE are so good.
I'm glad you like them, Umar.
I do. But hey, Maya, why are you so serious today?
It's nothing. A friend of mine actually met with an accident last week, so just thinking about her.
No. What happened?
She fell off her bike and broke her leg, had to go to the hospital and undergo surgery. But the worst part was, she didn't have health insurance.
Oh no. That sounds terrible, Maya. How is she doing now?
She's recovering, but the hospital bill is through the roof. She had to borrow money from me and a few more of her friends just to pay for it. If only she had comprehensive health insurance, it would have been way better.
Yeah, health insurance is so important, especially in cases like these.
And it's not just accidents, Omar. It could be something as simple as getting sick. You never know what could happen. And without proper health insurance coverage, it could cost you a fortune.
But didn't she even have group health insurance?
She did, but it didn't cover the cost of her incidentals in full. Those costs appear small, but when they add up, they might become as much as the treatment cost itself. All of that had to come out of her own pocket.
Oh, so sad. That's awful. I had no idea.
That's why it's important to have the right health insurance coverage for your unique needs, Omar. It covers everything from regular checkups to unexpected emergencies. And if you have a pre existing condition like diabetes, hypertension, or like in your case, your allergy to cats, it can still be covered. Cheers!
You are listening to policybazaar.ae's The Policy Project. We've got you covered.
Hi, how are you all today? Welcome to a brand new episode of policybazaar.ae's The Policy Project. I am Annie Arakel, the host of this podcast and your go-to person for all things insurance. As we heard a little while ago, the case of Maya's friend, health insurance is akin to having a superhero by your side, ready to swoop in and rescue your finances when illness or injury strikes. Now, the problem today is not that we're not covered by health insurance. Most of us are. But is what we have enough? Do we have the right health insurance? The one that is ready to rescue us and be our superhero in desperate times. That's the main question. And we are going to break that down today. And I'm going to do that with someone who's an expert in health insurance. Listed as one of the top 10 Indian women leaders in the UAE by Women Entrepreneurs India and currently working as a commercial director and insurance aggregator at Policy Bazaar, her work has taken her to locations like Philippines, Dubai, of course, where she works, England and Saudi Arabia and a few others. And now, of course, to our studio. Guys, please welcome Toshita Chauhan. Hello, Toshita. Welcome to the Policy Project. So excited to have you here.
Hi, Annie. Thank you for having me over. Same here. Excited to answer all the questions.
Toshita, going by the accolades you have received in so many years that you have put in the business of insurance, I am so pleased to have you here. And I have to ask you, first of all, how many years have you spent in this industry?
9 years now.
Nice. How did you come to that and how much are you enjoying this?
Yeah, I think banking and insurance always, if you see it from the outside, it seems like a very boring and very formal thing. And it was obviously not, I didn't imagine that I would land up in this industry. But I think what
Right.
we do uh, in insurance, especially at Policy Bazaar, we really change people's lives. And when you see
Nice.
the impact, when you pay out certain claims, when people are in the hospital, when there's a death in the family and you've just paid out, a life insurance claim and helped a family, I
Right.
don't think that feeling is comparable with any other thing, right? It is changing someone's life for the better. And that's why I think this industry is amazing.
Oh my God, that is amazing to know. And now let's get straight to the questions. We have lined up a few questions for you, which will help our listeners understand how crucial it is to choose the right health insurance in the UAE. So, to begin with, in which parts of UAE is it mandatory to get insurance?
So in the UAE, it is mandatory to get health insurance for if you are living in Dubai or Abu Dhabi. For the Northern Emirates, it is not mandatory yet, but there is news that the regulation is going to come out pretty soon. But in Dubai and Abu Dhabi, yes, it is mandatory, and every time you renew your residency visas, you are required to present a proof of a valid medical insurance policy.
Wow, that's interesting. And by any chance, if someone doesn't get it, what can be the repercussions?
Right. So, for example, in Abu Dhabi, they start to impose a fine. So once your medical insurance policy is expired, you get a 30-day grace period. And if you do not renew within that 30-day grace period, a fine of 300 dirhams every month starts to kick in, right?
Oh my God.
Yeah, that's
Okay.
in Abu Dhabi. So anytime you renew your visa, you will have that fine lined up if your insurance policy is expired. In Dubai, you don't have a fine yet, but every time you renew your visa, it's mandatory to present a valid medical insurance certificate. Otherwise, your visa application will not be processed.
Now, this sounds like it is more to do with employers, giving it out or dishing it out to employees. But if there are families who are looking at covering their children or wives, for instance, if wife is a homemaker, then does it change? Are the regulations a little different again in UAE and Abu Dhabi or Dubai and Abu Dhabi?
No, the regulation still remains the same. As long as you're a valid UAE resident, you need to have medical insurance, right, in both these Emirates. What sort of differs is in Abu Dhabi, your employer is mandated to provide um,
Right.
medical insurance cover for the employee and the dependents. In Dubai, it is not compulsory that the employer has to provide for the dependents, although the employer has to provide for the employee.
Mm.
So typically, your employees will, if the husband is, let's say, working, and he has insurance cover from the company that he works for, and the family doesn't, he would typically go out and get an individual medical insurance policy for the wife and the kids, for example. And that I think is very important because what people don't realize is that, hey, I
Mm.
am covered, and do I really need my wife, kids to be covered? Yes, you will. They are required to be covered under a valid medical insurance policy. A, because you will have to apply for their visa, and every
Correct.
time that you renew your visa, you will have to present that valid certificate.
Wow. So it's very important for my listeners to understand that health insurance is a must for every member of the family. Now, moving on to the next question. I had a colleague, Toshita, in Dubai who bought health insurance to get a residency visa, what you just mentioned. When he actually felt sick and was required to undergo a few treatments, much of that cost had to come out of his own pocket. So I think it is common practice in UAE since health insurance is mandatory here. So a lot of people go for this one with minimal cost or premiums just to qualify for a residency visa because they find it a little expensive. What do you have to say about this?
Yeah, so there are different kind of covers that you can opt for, and for example, Dubai and Abu Dhabi have regulated a basic cover of health insurance with a basic, sum insured and certain inclusions that that the policyholder has to be covered under. So that's, again, as the name suggests, it is a basic cover. It will cover you for
Right.
X amount of conditions. If you're a new policy holder, like for example, I don't have any other policy running in the UAE previously, and this is the first time I'm entering into a health insurance policy. In the
Right.
basic policies, for example, in Dubai, the insurance company can apply a 6-month waiting period for any new chronic illness, right? So there are policies which you can sort of take which don't have a 6-month waiting period. So
Okay.
depending on, your friend had bought what kind of policy, there may be
Right.
certain denials or, claims which can be declined by the insurance company. So what we typically suggest to our customers is that if you are living in the UAE for majority
Hmm.
of the time, right,
Hmm.
then you're better off getting a more enhanced, a more comprehensive cover, which covers you for all the conditions, that sort of are included in the policy. If you
Right.
have any pre-existing conditions, obviously you will need to declare that at the time of taking the
Sure.
policy so
Sure.
that there are no denials, at the time of claim.
So it's very important going by how heavily regulated things are back in Dubai and in Abu Dhabi and other Emirates also, that everybody does disclose whatever their problems are in the beginning so you don't have your premiums going up or your insurance claim kind of not being fulfilled by, I think,
Yeah.
the government. Um, that is very important, don't you think?
Yes, yes. So I think the other sort of loophole is that, hey, I have a pre-existing condition, and it could be as small, right, as borderline
Yeah.
diabetes, which is, again,
Mm.
these lifestyle conditions and disorders are very, very common now. So,
Correct.
and I may just say, hey, you know what, I don't want to declare it because if I declare it, the insurance company is going to charge me a higher premium or put a loading on the premium that I'm paying. And if ever I go to claim, the doctor will not get to know that I had this condition before getting the policy.
Mm, mm.
And I think what people don't realize is that the medical system here is sort of superbly integrated. So, and it's not hard for the medical practitioner or the doctor advising you that when did you get that condition, right? It's very hard to hide it. There are certain tests which will come up, which will show up that when did your condition develop. And then the insurance company sort of doesn't listen to you that you say, oh, I didn't know that I didn't have this problem. And most of the time when you go to the doctor, you don't really lie. You tell them the truth about, oh, I've had this problem for the last one month. And you know
True.
you've taken the policy in the last 1 week. So the insurance company knows that, okay, this was something that you knew before, but you did not, you chose not to disclose it.
Absolutely valid points that you've mentioned, and so fruitful for us to actually learn and understand about this. Now, in my next question, I'm going to move to pregnancy
Yeah.
requirements that any individual may have as a family, as a woman, and what kind of insurance, one needs to take for that. So, when I was about to have my son Kian, I was pretty peaceful because my health insurance covered
Yeah.
all my maternity expenses, okay? Right from the hospital to the delivery, which was a C section, to even my son's NICU time since he had jaundice. And now that is quite common in babies.
Right.
All of that was covered, and I was really happy they did it.
Yeah.
So, what are these important points we must keep in mind while getting a health insurance for pregnant women?
Right. So, see, I'll start from the basic, right? So, when you are getting a health insurance, we always advise that you should always have a cover. There should be no gap in cover, right? So, you took a policy last year, did not renew it, and next year you are again buying a policy.
Correct.
So, and why we say that is because there are always waiting periods when it comes to any maternity inclusion in the policy.
Hmm.
Typically, let's say in Dubai, there'll be a 45-day waiting period in the policy.
Correct.
So if you're pregnant, we strongly advise that you disclose that you're pregnant because it is very, very easy for the doctor to find out the start date, the inception of your pregnancy. We ask the customers to disclose their last menstrual period date, basis which we calculate whether they are pregnant or not pregnant, or whether they didn't know they were pregnant, for example.
Correct.
And we really advise customers that if you are planning for pregnancy, you take a cover which includes a certain hospital or clinic where you sort of know that you want to visit when you are pregnant, and you will have the entire treatment course there, and you will plan your delivery there. B, we really advise that what is if you have any pre-existing condition that could affect your maternity program, you disclose that, because anything at the time of delivery, if anything unfortunately goes wrong, and the clinic or hospital or facility finds out that it was a pre-existing condition, the insurance company will
Right.
most likely decline that claim. What
Hmm.
we also sort of very commonly get as a feedback from customers is that, hey, I am already pregnant, and a policy, if I disclose that I'm pregnant, will cost
Hmm.
me at least a minimum of 10 to 15,000 dirhams. And
Correct.
I'd rather not take that because I go to a certain hospital, and that hospital will give me a maternity package, for example, for 4 to 5,000 dirhams for a
Hmm.
normal delivery. And I'm better off taking that because I'll save 5-10,000 dirhams for this policy. But what they don't realize is, or probably they do realize, but what is important to note is that your maternity package at the hospital will only cover you for your scans, your treatment for the pregnancy,
Correct.
and your delivery. It will not cover you for any emergency medical situation that could happen in the next 9 to 10 months, right?
Hmm.
Also, as part of the regulation, the baby, when it's born, is covered for 30 days in the mother's policy,
Right.
right? So, if, like you mentioned, that your baby had jaundice when
Yeah. Yeah. Yeah.
the baby was born and had to be kept in NICU, and NICU cost per day, it's pretty expensive here. So, everything then goes out of your pocket. So, if you have that insurance plan, and let's say a 15,000, some sort of premium could get you a sum insured of 1 million dirhams, right? Which
Correct.
is enough for your delivery expenses and any emergency situation that could happen, God forbid. So we strongly advise that. And then we've seen our customers actually make a note of this and say, hey, what, I will not go for the maternity cash package at the hospital, but I'd rather take this because then I'm at least one thing is out of the way, wherein I know that, hey, I'm, at least covered for the entire treatment plan. If there's any emergency situation, I know that I have that
Correct.
cover, and then I can chill and enjoy my pregnancy.
Yeah, absolutely. And all of the time that we have the hospital, which is not always chill, by the way, but nevertheless, the point you're trying to make is, of course, it's not a cash package one should go for, but it is a comprehensive health insurance, even when it comes to, pregnancy.
And I'll add one more point to it. We have policies. For example, there are a lot of us from, living away from home. So, like I'm Indian, I'm
Sure.
living away from, my
Hmm.
family's back in India. And there are customers who prefer to have their delivery, let's say, planned back home because of the sort of
Correct.
the support system that they have there. Their families are there, etc.
Correct.
So there are policies who give you that cover that, hey, you could go and plan, you could take your treatment, etc., back home in India,
Oh, nice.
and that could be, yeah, that could either be a cashless thing or that could be basis a reimbursement thing, basis the kind of policy that you have chosen to buy.
Oh, that's so much better than one would expect to have in a health insurance. And these considerations are something that we shouldn't take lightly. Very, very helpful in the future for sure. And now moving on to the next question. Toshita, so we have a kitty party circle here. And every 6 months, I have new people joining the gang from different parts of the world, okay? Because, sometimes they've moved back here and so on. Whenever we meet, the word insurance does pop up. I've wondered why, but I think it's a good thing in conversations, of course. So, this country, UAE, being an expat country, I'm sure huge chunks of population are unaware of the insurance regulations and norms. So, I've obviously told them that there is a podcast I do, and I do speak with the best experts talking about various types of insurances, especially when it comes to health insurance. My friends have all tuned in. Tell me, how much health insurance cover should a UAE resident get if he or she is a sole earning member of the family?
So if he or she is the sole earning member of the family, again, they will sort of have the load of getting their insurance unless it's covered by the employer,
Right.
getting insurance for their family, which could include their spouse and kids, right? And it can be a pretty expensive affair to get the entire
Mm,
family insured. So I think few things that need to be kept in mind is what kind of um, sort of how healthy you are and how many
right.
pre-existing conditions do you have.
Mm,
If you're already on a certain medication or a certain treatment plan, we strongly advise that you disclose that because you will already have a certain amount of expense lined up, for that treatment.
right.
If you are fairly healthy, the sum insured or the cover on, how much you can claim up to, that could range from, let's say, 150,000 dirhams to 3 million dirhams, right? So
Wow.
on average, if you know you're fairly healthy and there's not really something you're expecting to go wrong in your life, and you maintain a healthy lifestyle, we would advise people to go in for like a 250,000 sum insured or 500,000 sum insured. If you want to
Mm,
be superly protective about, hey, whenever I don't know, if God forbid something goes wrong, I want to
correct.
ensure that my family is fully covered and there's nothing I need to pay really out of my pocket, then we really advise to go for a 1 million dirham sum insured.
Wow.
That it will ensure that for the next 12 months that you will be taken care of. If there was suppose any medical emergency or anything that you need to be treated for.
Wow, wow, very, very good. So I think my friends are going to follow up on this and come approach you to ensure they get the best health insurance. Now, moving on to the next question. With a good insurance plan, things like room costs, surgery, medicines, etc., are pretty much covered, like you mentioned. But what about the add-ons? A lot of us want to know this. Are there any health insurance policies that cover additional charges like that of emergency care, disposables, daycare procedure, ambulance, cost of medications, etc.?
So the good part here in this country is you are really almost covered for everything. Almost,
Wow.
right? If your ambulance cost is covered, your outpatient services are covered, which basically
Mhm.
means that you don't need to get admitted in the hospital. I'm just going for a consultation that, hey, today I'm not well,
Correct.
I have fever, I have a cold, or you want to take your kid to the doctor. So all these things are covered. Your diagnostic tests are covered, your MRI scans, it could be related to, as long as they are within the declared conditions, and within that
Right.
policy frame they will be covered. Things like optical, dental, they're also covered. There are options in the policies that you could pay additional to get these covers. Things
Nice.
like alternate medicine, for example, homeopathy, that could also be covered
Right.
based on the kind of policy that you've got. The covers are fairly comprehensive and enhanced and cover a wide range of things.
I am really glad you mentioned alternative medicine because that is something people have taken to since the
Yes,
pandemic, a lot more than it was before. I'm sure a lot of your customers come to you and ask you these questions, and I'm glad it is covered. Is
yes,
Ayurveda also covered under this then in that case? Because there's homeopathy, there's Ayurveda, there are
yes,
other naturopathy kind of treatments
yes,
that are available now.
yes. So there are certain plans under which these can be covered,
Lovely.
and there'll be a limit to it, right? That there will be a
Sure.
defined limit of how much you can claim in a year.
Sure, sure. Nice. Now, say that we have a listener who has a genetic or some predisposed medical condition. So, how can he or she go about planning their health insurance strategy?
Yeah, so I think for someone like that, it'll be very important, to have the right kind of health insurance plan. So what we typically do is we advise on what kind of condition, obviously, do they, we ask them about what kind of condition do they have already, what is the treatment plan they're already on, if there are any diagnostic results, test reports, etc. We ask them to share it with us. What we then have to do is we have to share it with the insurance underwriting team, who will sort of price, a premium and suggest which policy should really be taken for this customer, and that could take, let's say, 24 hours for us to come back to the customer with the sort of 4 5 quotation options and for them to choose from. What we really push the customer to tell us is where do they want the treatment plan, because again, the kind of policy that they buy, one hospital can be included and the other can be excluded. So if there is a preference of a certain facility to be included, that's essential for the customer to tell us. But yes, as long as the declarations are there, as long as the customer has informed us about all the treatment plans, all the pre-existing conditions, they will be covered.
Wow. Now, this is what I wanted to hear because, yes, many of us, thanks to the way I think the evolution is happening of humankind,
Yeah.
there are a lot of degenerative preconditions that we all are either born with or we develop
Mm.
over, the earlier years of our life. And that's really good to know. That brings me to my final question then, after which we are going to head straight to Ask Away. That's going to be our next segment. While the world thinks there are four basic necessities of life, there's food, water, clothing, and shelter. I think in present times, there are five: food, water, clothing, shelter, and health insurance. So, considering how unpredictable health has been lately, especially since the pandemic, like I've mentioned before,
Yeah,
please tell us about the importance of renewing health insurance policies.
absolutely. So we always tell, our well-wishers, customers, etc., that when you really need insurance, it's too late to get insurance, right? Because when you are in the hospital, in this case, or at a medical facility, you want to get a treatment done. Most of the insurers, will price it differently for you because they know that a certain amount of expense is already coming in for their policy because you have that condition. Um, and renewing policies for example, in Abu Dhabi, as I mentioned, because there is a fine, so there's a continuity in renewal. What typically happens, let's say in Dubai or Sharjah, is you'll get a visa for 2 years, 3 years, 5 years, for example, a residency visa, and at the time of getting the visa, you are showing a document of insurance which is valid for 12 months, the insurance policy, and then your visa, if you bought the policy in 2023 and if you've got your visa in 2023 and your renewal, for example, is due for your visa in 2025, in 2024, because you're not really claiming, you're thinking, hey, you know what, I'll just not renew my policy, I'll just buy it next year when I have to renew my visa, right? What really happens there is customers paid in year one, in year two they don't want to pay for their renewal. They sort of lose the benefits of being a renewal customer. So any kind of waiting periods, that the customer had crossed in year one will kickstart again if they have any lapse or gap in their policy. Yeah. So again, so there'll be, for example, a 40 45 day waiting for your maternity claims or 6 month waiting for any new chronic illness that has, developed after taking the policy, which again, when none of us can foresee, right, what chronic condition we could develop. So we always advise that, hey, if you have a policy, just keep renewing it because that's really will keep sort of your expenses under control, because when you're paying X amount of dirhams, and you could your medical expenses could really pile up in this country. It's not a cheap affair.
Absolutely. You may think you're saving some money because, like you said, it is an expensive affair. But I think in the long run, it is going to save you a lot of mental stress. And of course, ending up paying more, which could even be double of what you expected in the first place. Because, like again, you have mentioned in the earlier, questions that it's very, very important for us to understand that these are unpredictable situations. And so we better be prepared for it with a comprehensive plan. Okay, that was very informative. Thank you so much for such in depth knowledge on this topic, Toshita, which brings me to our next segment. It's called Ask Away. So, here we take up some queries from our lovely customers and we'll respond to them with the help of our expert. Now, if you're too curious, just like me, I mean, I'm always asking questions, then your questions about insurance and personal finance, whatever it is, it has to come to us. Just ask away. Slide into our DMs on Instagram at Policy Bazaar UAE or reach out to us via any other social channel, and we'll try our best to answer your questions in the next episode. As far as today's episode is concerned, we shall be taking up health insurance questions that we have received in our inbox. So, Toshita, are you ready to answer away?
Yes.
Okay, now this question has come from Amal Khan. He is a management consultant who's just moved to Dubai and is looking to purchase health insurance but is not able to decide. Typical problem, yeah, most of the times, especially if you're a first timer. So he's asking what health conditions are usually covered under health insurance and what are the ones that are excluded usually.
Right. So I think I'll sort of answer with what is excluded, because that'll be a shorter list.
Hmm.
Of course, anything that you currently have as a pre-existing condition and which is
Right.
not disclosed will be
Mm.
excluded, because the insurance company has not priced that for you.
Hmm.
But the standard exclusions would be, let's say, cosmetic treatments, right?
Okay.
Acne treatments, for example, anything to do with hormonal defects. Certain hormonal defects are excluded. There are certain
Right.
birth defects which are excluded as well. So these typically would be the exclusions. If there is, if you bought a plan which doesn't include dental cover, etc., that'll be an exclusion. So
Mm.
so typically, let's say in my policy, I had the root canal which was included, but if I wanted to, get an Invisalign or get braces, that was excluded. So
Ooh.
so anything which comes under cosmetic treatments will be excluded. Anything which comes under medical emergency will be included. So they've made it very so it's very easy for the customer that, hey, if you are in a medical emergency, most of the things that are required to put you back on your feet will be included.
Right. I think that answers your question, Amal. Because, yes, as a first timer, if at all you are, then I think these are some of the questions you need to ask. And now that you know the ones that are excluded, you can always have your own list. Ask when you meet your, expert, someone who is your agent, someone you must need to learn more from. Then I think you will have it there. Thank you so much for that question. Moving on, the next question comes from Kavya Murthy from Jeddah, living now in Dubai. She's an interior designer, and she asks, are there any restrictions on the healthcare providers that can be used under an insurance policy, or can one avail the services of any doctor of their preference?
Right. So that's a great question, right? Because most of us, we know where we want to go,
Yeah,
which facility we want to go. Either we'll have a doctor that we're comfortable with, or we have a friend who knows someone that she's been going to that hospital or clinic.
sure.
So when you buy a plan, an insurance plan, you will always have a network list attached to it of hospitals and clinics. Right now,
Clearly.
there are tiers of hospitals. There'll be a basic hospital, there'll be sort of a mid-range hospital, and there'll be a
Yeah.
super specialty hospital. So, basis on the plan that you're buying, certain hospitals will be part of the list where you could claim.
Hmm.
Certain hospitals
Hmm.
will be completely excluded in that
Right.
list. So these things are managed by someone called a third party administrator, right?
Okay.
And these will have their own network list that, hey, if you're buying a plan A, this is the network list, this hospital is covered, this hospital is not covered. So
Mm.
again, at the time of purchasing, our sales advisors and our insurance specialists really push the customer to answer this question. Some of
Right.
them are fairly new to the country and they don't have a preference that, hey, I want to go to this hospital or this clinic. So we guide them that,
Nice.
which
Of
is
course.
the residential area you live in, which is the office you live in. So I think that's very important that when you're buying a plan, you should ensure that, hey, is this hospital or this clinic covered? If not, I want this covered. So please guide me and suggest me that, plans in which these clinics are covered.
Oh, lovely. Which means, again, if you ask the right questions, you will have all the answers. And I hope, Kavya, this, what Toshita just mentioned, answers your question. Brings me to the final query we have for Ask Away. Now, this is from Ramya Ali, who's a chef. Interesting. She has been living in Dubai since a year now and asks, how do insurance companies determine the cost of premiums, co-payments, and deductibles for a policyholder? And how can one negotiate the best terms for themselves?
So it's fairly simple, right? So here, your insurance premiums are determined basis obviously your gender,
Right,
right? Because both males and females have different way they claim and the condition they claim for. It depends on the age band, right?
right.
So certain when you move from a certain age band above a certain age band, your premium could differ. Even though let's say you've had no claims, but that's just the age band loading that the insurer
Sure,
would
sure.
apply for. And basis the plan that you're buying in terms of what are the inclusions, what are the exclusions, which hospital is covered, which hospital is not covered. There are basic plans, there are mid-range plans, then there are the superbly premium plans.
Right,
On the what is the sum insured that is covered, so you could have, let's say, a plan for 600 dirhams, which include the sum insured of 150,000 dirhams, right? Whereas you could have a plan for 5,000 dirhams, which includes a sum insured of 1 million dirhams.
right.
You could also have a plan for 2,500 dirhams, which includes a sum insured of 1 million dirhams.
Wow.
But it is a combination of what is being offered as part of the policy.
Sure.
Um, so I think, of course, budget is a constraint for a lot of people, right? It's a major deciding factor. But
Mm,
we really suggest, hey, here you're talking about your health. So
correct.
please ensure that whatever you want included, you're paying for that, and we will guide you accordingly.
Sure.
And the last part of the question is, what are the sort of co-payments that you'd asked, right?
Yeah,
So
yeah.
co-payments is basically when you go in for a service, what is the amount that you pay from your pocket, right? So
Mm,
for example, a consultation, if I'm going in to just meet a doctor saying, oh, I've been having these headaches for the last 1 week and I don't know what's wrong with me. Could you have a look at me? So typically the co-payment, let's say for example, is, hey, for the consultation it's 50 dirhams or it's
correct.
10%, or you could have options where there is a 0% co-payment. You don't pay anything.
Mm,
But then again, the premiums will be priced accordingly. So you could
mm.
have co-payments which range from 0% to let's say 20% for different things in the policy.
Sure, sure. Wow. Okay, and this also means that if there is at all a preference doctor that you have found in the first year itself,
Hmm.
is there a possibility that the customer can tell them if at all this doctor can also be included? Is there a way that those terms also are negotiated?
Yeah. So what typically happens is the doctor will always be part of a facility, right? So there
Mm.
are no individual sort of operating.
Practices.
Yeah. So he will be associated with a clinic or with a hospital,
Nice.
and that would typically be in the network list of the insurance company.
Sure, sure.
And then basis which range does he fall into or she falls into as a medical practitioner, we will then suggest that, hey, you can buy plan A because that covers this hospital in which this doctor operates in,
Correct.
or B, you can buy this plan because this covers, this doctor.
Right, right. Sure. What I like best about UAE, I think, is because of these regulations that are well laid out.
Absolutely.
You have an answer to these questions. So, as a customer, there is a lot that we can look forward to. And as an expert and as an agent, there's so much that you can also offer. I have loved this session. Thank you so much, Toshita. You have been such an incredible guest.
Thanks, Annie. Thank you so much.
I'm really, really hoping to see you soon. Take care of yourself.
You too. Thank you for your time.
All right, this brings us to the end of the segment. Time seems to have flown in this episode, right? Well, that's what they usually say. And time flies when you are having fun. It flies faster when you learn along with the fun. But don't tune out just yet. If you have any questions about insurance and personal finance, then simply ask away. DM us on Instagram, follow at Policy Bazaar UAE, or reach out to us via any social channel, and we'll try our best to answer your queries in our next episode. For now, I hope you're up to date with the concept of health insurance. We shall meet again in the next episode with more informative and insightful content, along with our wisdom warehouse industry experts. Till then, take care and stay tuned. Bye bye.
You were listening to policybazaar.ae's The Policy Project. We've got you covered.